physicians don't really like to treat people like us because, well, not only were we doing a $700 a month insurance bill, we had a $2,000 deductible because we thought, what the heck, let's just not get sick. Well, when the physicians see that you have a $2,000 deductible, they're concerned that they're going to, are they going to get paid their first $2,000 because they're the first people that you see. So anyway, not only that, the system is set up to go to physician after specialists and back again, and so you end up having to sit in many waiting rooms where people are sick. Good Lord, I would just as soon try to write out whatever's going on with me than sit in a room with a bunch of sick people and get sicker. Every time I've had a pain, I had a pre-existing condition, and when I got new insurance, I told the new insurance company about it, and I was not going to be insured for that. And I thought, well, I'll probably be cured and I'll probably be okay. But at this point, I'm not so sure. But I do know that I'm not insured over that. Every time I have a pain in that area, I ask myself, well, what are you going to do about this? Illness comes back. The concern makes one consider how much truth you're willing to tell the physician. In any case, the length of time one is feeling pain will be compromised, so the insurance will cover the illness. This practice confuses the health care community because they are trying to figure out how long an illness has invaded a body and how far along the illness is. If the time has been fudged, the caregiver cannot heal properly. If this is not, the individual is faced with the concern of bills that would not only take their possessions, but their dignity. I can go on about the various health insurance abuses we have suffered as individuals and as business owners. The cares of business owners on a daily basis are surmountable. Healthcare should be about choices, choosing adequate quality insurance, choosing your own doctor, choosing affordable health, private insurance for public health options. Healthcare should not be about the insurance industry, discriminatory denies coverage, and the skyrocketing costs that threaten the life of a small business. Congressman Johnson, won't you consider hearing business owners' concerns at the Saturday town hall meeting about healthcare reform? We are the backbone of Champaign. Everywhere you turn, there is small business. We deserve the opportunity to be heard. By the way, we too are a small business that is not hiring very many people because we can't afford to give the health insurance to our employees.
I want to say thanks to the committee and everyone who allowed me to speak my voice finally when it comes to health care. Like you said, my name is Lucretia Williams, and I'm working hard to grow my business, Lucretia's Body Oils and Sprays. Right now, I employ 2 family members who fortunately are covered with health care benefits from previous employers, one through retirement and the other one is dependent coverage. But in the process of growth of my small business, and as I am able to hire more staff, I am interested and would like to offer coverage for all of my employees, including myself. The concern of affordability while trying to sustain and grow your business in this economy is hard for any business owner. I cannot hire on more employees because the cost of coverage is more than I can afford. It is not that I'm not willing to pay, I'll pay something, but on the contrary, I am just can't afford the various rates that I have found. The small businesses that I network with are all saying the same thing, and we just want the following. We would like to see reduced and affordable costs for health care for both employer and the employees. We would like to give the employees a choice of health care options. I come across people who are very satisfied with their care and their providers, and they shouldn't change. For those of us who need an affordable change, we should have that opportunity. I want to ensure that my It is not enough that our state covers children. We need to do the same for those that care for children. I want the affordable health care to include preventative maintenance, which I feel is very, very important. Classes on preventative health, also another important issue. And another important issue, they're all important, but dental coverage. I actually went to the dentist last week and I was inquired about where can people go for dental coverage. And basically I didn't get an answer. I did if it was a child, but not for adults. I got the runaround, I got all these different websites that I could go to, but I am an advocate because teeth are important as well as your health care per se. With the economy the way it is, small businesses are already nervous about their future. We deserve to be heard by those we elect. We deserve to be supported by those we elect. I have been in Champaign for some time, and I have never seen Congressman Johnson in our community addressing this pressing and current hot issue. Before the vote in August, the people, business owners, families, providers, social service workers, everyone deserves the opportunity to speak with you. Congressman Johnson, in a forum where you stance your proposed legislation to improve our health care system can be stated clearly. Congressman Johnson has scheduled meetings all around Champaign-Urbana on days that are difficult for most to travel and attend these meetings. And the only reason I'm here is because I'm on vacation. The topics of these town hall meetings are very unclear, and we are looking for the opportunity to talk to Congress Johnson about healthcare issues, reform, maybe on a Saturday before a vote happens in Congress in August. The Champaign-Urbana community is as deserving as Rantoul and Danville. We can even have it with you while you do your weekly Saturday morning talk at Lincoln Square, and I do see them walking there quite often. The point is we want to be heard. This is a very important issue, has been an issue for a long time, and in a country that we call land of the free, we need to adhere by that term. The point is we want to be heard, we want answers, we want to clearly understand whether or not you support small businesses and their need for health care reform.
Again, my name is Josephine with the Campaign for Better Healthcare. I'm the Downstate Organizing Coordinator. And I again want to thank Dr. Kessler for allowing us to use his space and for really giving a platform for small businesses to speak out about the issue of healthcare reform. It's not just small businesses that are suffering from, that are really dealing with this issue of access, issue of affordability, choice, and the option to keep your doctor, to change your coverage, to be able to really research and have a competitive market that offers everything that an individual needs, a business needs, a community needs. And we're really asking for the people of Champaign, for the people of the 15th Congressional District, to join us on July 25th. We are going to have a public event, and we welcome Congressman Tim Johnson to join us and to really address the community and to address the public's concerns and questions regarding healthcare reform and where he stands. That's again July 25th. And the other thing that we're really asking our community to do is to call his office and to ask him to support healthcare reform, to ask him to support choice for communities and the public option, and to ask him to clearly stand in support of the overwhelming demand and the overwhelming voice in the community that supports healthcare reform. If you want to call his office, his number is 217-403-4690. You can call him, ask for him, make sure that your name is taken down, that your information is taken down so that your voice is counted. You can also visit the Campaign for Better Healthcare's website. It's www.cbhc.org.